Then role prompting. This is very interesting. Uh, Role prompting is that you tell it that what is your role? Are you a uh, mm, behave like a professor of pathology teaching second year medical students, or act like a counselor, act like a psychologist, act like a forensic medicine specialist, act like an anatomy teacher. I mean, you say that you just give it that you are an expert in something, and then you create, and this gives the prompt a particular professional uh, identity, and then it generates responses, and it leverages the communication style, the depth of knowledge. You say, I'm a postgraduate teacher, I'm a PhD, I'm a Nobel Prize winner on this subject, and it will give you the answers like that. And it gives you expert modeling, that is how specialists in different fields would approach that particular problem. If you are a pathologist, you say, I'm a hematologist. And then the various specialized knowledge points they come up. And supposing you want to give the same knowledge to the patients who are not who are non-medicos. So you will reframe it that this has to be given to those particular uh, s- uh, people who are not educated, and they are rural patients. And you can even ask it to give it explanations. This is personally speaking, I find this as the best prompt. I'll tell you just now why. Of all the prompts, this role prompting we use quite often. And uh, mm, I'll just so I'll just You are a pathology professor teaching second year medical students. Explain the classification of anemia based on red blood cell morphology, include key microscopic findings, associated findings for each type, and typical laboratory values, and use language appropriate for students who have completed basic hematology but don't have any clinical exposure yet. Fine. So I press. I think it is. I'll start a new. Since you have already studied basic hematology, we'll build on that knowledge without assuming clinical experience. Microcytic hypochromic anemia, key features, lab findings, normocytic normochromic anemia, explanation, blood loss, anemia of chronic loss, lab findings, macrocytic anemia, tips for student, always correlate mean corpuscular volume with peripheral smear, mnemonic aid, micro, normo, macro with the uh, examples.